สวัสดีค่ะ Good evening ค่ะดร.ธนรักษ์
สวัสดีครับ Dr. Thanarak. I hope you are not tired yet having to answer same question, talking about same topic for almost 2 months now, right?
but the issue evolved quite a lot from early situation, and then we have an outbreak in the middle of March, and now the situation is getting better, and we are implementing the new strategies, active case finding, and I guess this will be our discussion this evening as well.
That's right. That's true. That's true. Yeah.
Especially on active case finding and 40 cases in Yala. So finally, have we got results of the third round of the testing?
Excuse me. Could you please repeat the question again?
Yes, with the 40 cases in Yala, which we know that there are conflicting results between the first round and second round, and I presume that right now it's during the third round of lab test. Have we know the result yet?
Yes. The result of the third test is not coming out yet. Let me tell you about what happened in Yala. First of all, when the situation of COVID is getting better, just like what we seen at the moment, what we would like to see, or what we would like to do is that we would like our public health officer in each provinces that has an outbreak before went out and try to identify the areas that probably that has been affected by the COVID-19. Identify the areas and went out to do some more testing in the population. Those are the strategy that we call active case finding. So it is not just went out anywhere randomly, but it guided by our epidemiological data, which area should be tested, what kind of place or venue that we should go in and do some testing. This strategy will be successful if we have enough testing capacity. So that is probably why in the last few weeks or last month, starting from last month, we're talking about expanding the testing capacity in every provinces in Thailand. And that is why we asked every hospital, every provincial hospital to test for COVID-19. So now almost every province has that capacity. In Yala, they try to set up the lab in Yala General Hospital, and they open for the testing. Now, the team from Provincial Health Office, Yala Provincial Health Office, identifying the areas that they would like to do the active case finding. They went out, collect the specimen, and then sent to Yala General Hospital. And the result, as we knew it, they collect about 300 something specimen, and on a few days ago, they announced that 40 of the 300 something tests were turned out to be positive. Since the number of positive was a little bit, the percentage was kind of high, so we kind of questioned of what happened, and we asked them to repeat the test again, and then they repeat the test at different testing sites, different laboratories. They sent the specimen to Songkhla, which is the regional laboratories of Department of Medical Science. Songkhla test those 40 specimens from 40 patients. It's turned out to be all negative. So this is something that has happened. And then at the moment, we request that they repeat the test once again. But this time, we asked them to send a specimen to Department of Medical Science in Nonthaburi. And if they have specimen from the first and second test left, we would like those samples to be sent to Nonthaburi as well. For the test of of this kind, this test we call it polymerase chain reaction or PCRs. It is a very sensitive test. Very few virions of very few virus can already be detected. But its downfall is that it can be also easily contaminated. In that, I mean, if there is the virus that contaminate the samples, other samples, the result can turn out to be positive as well. So it is a very sensitive test. So the lab has to be very, the technician has to be very keen on doing it. So today, the team Prince of Songkhla universities or Songkhla Nakarin universities and the team from regional laboratories in Songkhla went to supervise and went to investigate on what happened in Yala General Hospital laboratories. We should know the result very soon on what is going on or what is the problems that happen.
No, but Dr. Thanarak, but as far as the process of the testing is concerned, there was no difference, right, between the process in Yala and Songkhla. Exactly the same process that were used in testing the 40 people.
It is the same kind of test, PCR test, and actually the lab in Songkhla is the one who helped Yala Provincial Health Office setting up their laboratories. So Songkhla is kind of supervisors to Yala General Hospital laboratories.
And in worst case scenario, if the result is 40 cases positive, what will it tell us, and what would be the measure that should be following?
At the moment, although the test result has been ambiguous, I would say ambiguous. The first test was positive, and the second test was all negative. Yala Provincial Health Office already take all of the patients in. I would like to call them patients at the moment, and isolate them and taking care of them at the moment at this time. And their plan is to continue to take care of them in the hospital until the confirmation of the laboratories came out, and then they will make their decision again on what they would like to do next. So in this case, although all of the case turned out to be positive or negative, it doesn't matter because they are already in safe place, and they won't, although they are positive, they won't transmit the disease to anybody.
And we have the contact history of these people, right? We know whom they have been in contact with before they were identified as being infected, right?
Yes, of course.
Okay.
I would like to say that at the moment we are ease our lockdown measures. When we start to ease those measures, one of the things that has to be strengthened, I already mentioned that when we start to loosen something, we have to tighten up something. The measures that we tighten up will be our public health measures. And in that, I mean that we have to try to prevent even more. We would like to do more testing or detect more cases by doing surveillance and also by doing active case finding. And then if anybody turn out positive, we would like to treat them and then controls. So prevent, detect, treatment, and control. Those are our main measures that we are going to tighten up or strengthen in the time that we ease some of the social measures.
Yeah.
And Dr. Tanarak, yesterday we have got the report of 18 new cases for migrant labor in Songkhla province. And how does this concern you? Are we going to repeat the same path like in Singapore with the issue of migrant labor?
Actually, it is different settings, totally different. The setting in Sadao, Songkhla is illegal migrant workers who has been caught enter the countries or enter the kingdom illegally, and we put them in certain place, wait wait for the officers to process, and then we are going to request them going back to their home countries. So actually it is a temporary shelter for all of the illegal migrant worker that has been caught by Thai officers. And there will be certain process in charging them and then push them back to their home countries. So this is more like temporary shelters, not the migrant workers who stay in the countries. So at the place it was always is a little bit crowded, and we already know that before this 18 positive a few days ago, there were reported of around large numbers that has been positive in the same place already. So one thing that I can say that is the case or the situation will not spread outside the temporary shelters. So I'm not worried that much. What we would like to see is that we would like to see the case in that shelters coming down a bit. Every attempt would be trying to control the spread of the disease within that shelters.
And what about the migrant workers themselves? Do you have plan to accelerate the active case finding process among these people?
Active case finding, as I mentioned earlier, we are using our epidemiological data to pinpoint where we would like to do some active case finding. So we are going to do it in the areas that we found certain number of cases in certain number of time. For example, if I would like to give you an example, it would be like, for example, if there are 3 cases in the last 14 days happen in the same areas or in the same apartment or in the same factories, we are going to go in and investigate and probably test everybody in that village or in that factories. Those are the ideas of how we are doing active case finding. So at the moment we have very few cases per day. If we would like to use those strategies, we have to use the investigation result from the past to pinpoint the location. That is because if we do it randomly, it should be very costly first, and then very few will turn out to be positive. In some areas in Bangkok that we have been trying to identify the hot areas, if you would like to say, we went out and tested something like 2,000 people. Only one turned out to be positive. And I remind you once again, those tests cost around 2,000 baht. So doing just 2,000 tests, that is 4 million baht already. 4 million baht to identify only one case. That is quite expensive. But if we can identify the areas that has more positive result, that would be more beneficial to the public health.
Dr. Thanarak, as you know that the past Sunday was the first day that the shutdowns measures were relaxed, right? And people were, they celebrating, the return of some semblance of normalcy. But I'm sure that you must have been disturbed by scenes of a chaotic situation at certain convenience stores and supermarkets, right? People fighting to have their hands on the beer boxes. And this morning, Bangkok looked like it was returning to the old Bangkok again with traffic jam on the street. So do you have anything to say on this as something to remind people that we are not yet out of the woods?
yesterday I gave this interview and there was one of the hosts saying that I repeat myself too many times in the last few days. But I'm saying
but
it
this is
again.
Doctor
This
always
is
has a
not,
habit of repeating instructions.
yeah, yeah. But I'm glad to repeat it. And I think everybody have to understand. I think one of the very important thing is that although we have one reported case in the country today, but it doesn't mean that we have only one case in the country today. And if any days that we have, let's say, 0 case or no cases reported in the countries, it doesn't mean that we doesn't have any case in the countries. The problem this came from the truth that the disease itself in high proportion number of cases it will be very mild. People will not think that they probably caught the disease and so they are not going to see the doctors. So that is why we have to do active case finding to identify those cases as early as possible so that they are not spread the disease further. Because of those assumptions that probably there are cases in the countries somewhere that we don't know and we cannot identify at the moment. That is why we have to always be very careful. And anytimes if we let our guard down, if we relax ourselves, the government can relax their rules, but we cannot relax ourselves in terms of preventing ourselves from getting the disease. So what we should do is that we should understand the situations and keep on working hard, very disciplined in trying to prevent ourselves from getting the disease. We should not go into public places too often. We should still wear face mask. We still have to wash our hands frequently, and we also have to eat clean food, well-cooked food, those kind of things. We have to keep working on that. And if we look at the countries, example from other countries, that they relax their measures very soon, and then people let their guard down. In Singapore, in Hokkaido, Japan, and even in Japan itself, the epidemics or the COVID-19 can come back very rapidly. And we have seen those lessons, and I hope that we are not going to repeat those lessons. So we should then learn from them and think about it and prevent ourselves from those situations.
Of course.
Dr. Rak,
Yeah.
we know that you have been repeating yourself for weeks now, but we are glad that you have been doing that, because that's was Dr. our force to remind us of the things we don't want to hear or we want to ignore.
Yes, that's
Right.
right. We cannot let our guard down. That's what we have been telling our audience as well.